My guest today is Dr. Darshan Doshi. He is a neurologist and he's been celebrated across the world internationally for his pioneering work in the fast treatment of strokes to prevent disability and to give the patient a full life. As part of our collaborative series of conversations with the PD Hinduja Hospital and Medical Research Center, today we talk about strokes. We talk about prevention, we talk about treatment, and we talk about second chances. Dr. Doshi, thank you so much for speaking with me today. I understand that you're very passionate about the treatment of strokes specifically, and you've dedicated your entire career to treating strokes. Tell me why this means so much to you.
One, if you look at the statistics in stroke, it is one of the second leading cause of disability, the third leading cause of mortality worldwide. But still, if you look at the awareness amongst people, people are not knowing the symptoms of stroke. They do not know what to do when a stroke occurs. And stroke leaves a lot of disability, not only to the patient, but to the whole family. The whole entire ecosystem is broken, if I would use that word. So, and now, unlike 20 30 years back, we didn't have treatment options. So anybody who used to have a stroke didn't matter because there were no treatment options. But now we have so many treatment options, we can make their life so much better. But sadly, people are not being so much aware about that illness. That is why I feel like, and I like, it's like an adrenal rush for me when I see a stroke patient. Like just before coming to your studio, I had an acute stroke patient who was there, but we immediately got things rolling for that patient. And that gives me immense pleasure because I know that by doing this, I'm going to make a big difference in his life. That is why, like, I am so much passionate in stroke.
Tell me what a stroke is. What happens inside the brain during a stroke? What is a stroke?
So, to put things in a simple way, stroke is any disruption of a blood vessel to the brain. Okay. So, there are two types of stroke. So, one is where there is clotting happening in the blood vessel of the brain, and one where the blood vessel ruptures in the brain.
Hmm.
So, there are two different types of stroke which commonly occur. So, in simple terms, for a layperson, stroke is equal to brain attack, is similar to what an heart attack is.
Hmm.
So, for a person to understand that, it's just that the blood vessel of the brain gets affected in some way, and the patient is left with some symptoms which cause a disability for them.
What are the symptoms of a stroke? How do I know if either I'm having a stroke or the person in front of me is having a stroke?
So, very simple mnemonic to remember is be fast.
Hmm.
B is for balance. That if you suddenly lose balance, I'm using the word suddenly. So, whenever anything happens acutely, that should be a red flag for you.
Okay.
So, whenever somebody suddenly starts losing balance, that is B. E is for eyes. When someone suddenly starts losing vision in one eye and starts seeing less with that eye, that is a sign of stroke.
Okay.
F is for face. If you notice a face to start drooping, if somebody's face has started drooping, that is a sign of stroke. A is for arm. Arm means if one side of my body becomes weak, I'm not able
So
to
you're
lift,
not able to hold it up.
hold it up. Exactly. So you should try to lift your hand up. If that hand stays up for more than 10 seconds, it's okay. But if it starts falling down, that means that it's weak on that side. And same thing with the leg. If you're able to hold the leg up for say 5 seconds or more, then might be okay. But still you can be having a stroke if it's you're feeling it to be slightly different from the other side. And S is for speech.
Hmm.
Speech means if my speech starts slurring, or if I start to blabber, or if I'm not even able to say words. Like we had a patient last night who had come in. She was not able to say the words completely or complete her sentences. So that is a sign of stroke. And T is for time. So time is crucial. So when you have any of these symptoms, anybody in your family or around you, immediately rush them to the hospital. These are the symptoms. Simple mnemonic, be fast.
Is there, for someone who is experiencing a stroke, sometimes the assumption is that it will be very dramatic and one side will immediately, have paralysis. But sometimes it's not that dramatic. It's just like you said, a slight feeling of something is off. What does that feel like on the inside?
So, thing is, for the patient, definitely it causes a lot of anxiety and also panic. Uh, so, what happens is that it depends on how much of the blood supply to the brain is affected.
Yes.
So, if it is a small vessel which is affected, so I give an example to the patients that we have this BMC municipal pipeline that comes. So, if you that pipeline is so big to begin with, but the pipes that come to our house are so small. So, if there's a disruption at the origin or is there disruption at the end vessel, means that is the pipes that coming to our home, symptoms will be different. The amount of brain that is affected will be different, and that is how the symptoms can vary from very mild to a quite severe symptom.
So even if you have the slightest feeling that something is wrong, it just makes sense to go to the
Yeah,
hospital.
exactly. So I would ask you the question: if you had some chest discomfort, what would you do? Would you wait it out, or would you say, let's get an ECG? If it's okay, I'm fine. You see, that's the awareness, because we don't want to take that risk, because it's engraved in our minds that if something happens to my heart, it's going to be bad for me. But the same thing is for the brain. Why not check it out?
Yeah.
It might, if at all it turns out to be normal, go home.
Yeah.
But if there is something you're missing out on very crucial window, this is very important and which should not be missed, because because sadly for us, our time windows are small, and with our kind of traffic, our kind of region area where we live in, it's very difficult to even commute, go from place A to place B. Even that takes time. So whenever any symptom, rush to the hospital. If things are normal, go back home. But please get yourself evaluated. That's what I would just suggest everybody to do that.
What kind of hospital should we go to specifically for a stroke? Is there a difference in the capability?
Yeah. So thing is, see, in India is quite different in demographics, geographies, and a lot of different types of hospitals and are around. But what we advocate is to go to a stroke ready hospital.
Yeah.
So what does a stroke ready hospital mean is that you have the whole ecosystem of care of stroke right from arrival to the hospital emergency to the time you get rehabilitation and go home. That whole ecosystem within one hospital is a stroke ready hospital. So if you are around a stroke ready hospital, please go. Like how Hinduja is a stroke ready hospital where I work. Similarly, but that does not mean that you should not go to your nearest hospital. Okay, because you might not have the facilities at all places. But I would suggest to go to a hospital where there is at least a CT scanner in the hospital where you're going, so that the scan can be done immediately and decisions regarding the treatment modalities can be applied immediately. So, at least to a hospital where there is a CT scanner at least available, that saves time. Or at best, if you want, then a stroke ready hospital, I would definitely recommend.
So if preferred, we go to a stroke ready hospital, but
Yeah,
it's
but
important to go to the nearest
nearest
hospital.
hospital, that is the most important thing. Even if the stroke ready hospital is some far from your house, do not waste time in going there. Please go to your nearest hospital, whichever has is close to your house, without wasting any time.
You're not wasting any time. What causes strokes, doctor?
So,
Is it is it something that we are doing, or is it genetic? Why
so,
does one person have stroke?
so stroke, there are certain risk factors in stroke. Some of them are non-modifiable. Non-modifiable means, I mean, the age, gender, genetics. All these things are non-modifiable because we cannot change them. But you would be surprised to know that 90% of the strokes are caused by 10%, 10 modifiable risk factors. So
Okay.
if we take care of those 10 risk factors, almost we can prevent close to 80-90% of the strokes, which is a huge number.
What are these 10
So
things?
these 10, I divided it into two parts.
Yeah.
One which is can be modified by the doctor, one which gets modified by the patient. So by the doctor comes hypertension,
Mm.
diabetes, high cholesterol, something known as atrial fibrillation. There is an abnormal heart rhythm, and a TIA. TIA is a minor form of stroke. It is like a warning sign of stroke. If somebody has that, the doctor can immediately rectify that part, and factors which the patient can correct. They are the diet,
Mm.
exercise. Number three is smoking, alcohol, and number fifth is inactivity. So these are the five things which the patient can correct. So if these factors altogether, 10 factors, if we are taking care of, almost 80 to 90% of the strokes can be prevented. So it's a huge number.
The smoking and the alcohol, in
Mhm.
your opinion, does that lead to strokes? I mean, you said directly if you have to stop
Yeah,
smoking.
definitely yes. So both smoke, but smoking contains nicotine, it contains from combustion produces carbon monoxide. All this stiffen the blood vessels.
Mm.
Blood vessels keep on stiffening, your blood pressure keeps on going up. There is always a sympathetic drive, means it's like a fight or a flight response that develops because of nicotine, and all that over a period of time. It's not going to happen one day of smoking, but it accumulates with time, and that impacts the blood vessels, that damages the blood vessels, and later on leads to stroke. And same thing with alcohol. Alcohol, so as per us, no amount of alcohol is good,
No, zero.
is zero. But if someone wants to wants to consume, then red wine in moderation is okay, as per our recommendation.
And what we call hard liquor,
Mm-hmm.
which is your whiskeys and your bourbons and things like that. You're saying you should be completely off.
Completely off, yeah. For us, because it has shown scientifically proven that alcohol damages the it's not just damaging the vessels of the brain, but elsewhere also it increases the risk of cardiac problems, it increases your liver problems, it increases also has some impact on the kidneys, so all the systems of the body and in some way or the other getting affected by it.
You mentioned TIA.
Hmm.
Can you explain to us what that is?
Yeah, so this is something very important. It's known as a transient ischemic attack.
Okay.
What does that mean is that it's a warning stroke. It's a mild stroke that comes. I'll give you an example. Like last week, I had a patient in the OPD. He said, so 2 days back, when I woke up from sleep, I could not lift my right hand for 5 minutes, but then it became normal. So I thought
Oh.
it was all normal. I just slept on that side. Probably it was weak. And today morning, again, I had a similar event. So what he described was a transient event of weakness, which most of the patients neglect, thinking it is one-off event. Probably I slept on that side, I must have lifted something heavy, and neglect that symptom. But that was the warning symptom for him for a stroke. Luckily, the second event was also a warning by the time he came to me, but immediately we started him on medications, because if these symptoms recur, he could have become completely weak on one side. And once you come with that symptom, it becomes very difficult for the patient to recover, because it leaves a lot of disability further.
So effectively, a stroke is when a portion of the brain is not getting blood supply, either because of a blockage or because of a
Bleed.
rupture or a bleed. And the longer that portion stays without blood supply, it will start to die.
Yes.
And you will start to lose function, whatever function of your
Yes.
body that portion of the brain is handling.
Yes.
That's what you will start.
I'll give you important statistics for that, which because statistics is something what relate to people. If there is a major vessel that is blocked in the brain, okay, with every minute you lose close to 2 million neurons with each passing minute. And with each passing minute, your brain ages by nearly 3 weeks. So you can imagine if there is a delay of 30 minutes, how many cells have already died? So you can, so that is why we need to act fast. Never waste a single minute, even at home, thinking what is to be done.
Doc, you talked about getting the patient to the hospital. What happens once they're at the hospital? Once you have established that this person has had a stroke, what treatment is available?
Yeah.
What do you do?
So, as I said earlier, like 20, 30 years back, we didn't have too much of treatment available in stroke at all. Now we have a lot of treatment options in stroke. The most important is the golden hour, which is the first 4.5 hours in stroke. So, whenever there is a clot in the brain, which we call as an ischemic stroke, within the first 4.5 hours, we can give something known as a clot busting drug, which has shown to improve the stroke recovery by almost 30 to 40% over a period of 3 months, as compared to a person not receiving that drug. So, which is one of the most landmark treatments that has come in stroke, which is always there in cardiology for the heart, but never for the brain. But now we have that option for the brain. So, whenever within the first 4.5, that is why I say time is very crucial. Don't waste any single minute anywhere. Reach the hospital, because earlier you receive the drug, the better chances of a good outcome. And another treatment modality, which is also quite groundbreaking, is something known as thrombectomy. So, what does that mean is that you, through a small wire, go to the brain, wherever the clot is located, we pull the clot out and restore the blood vessel, restore the blood flow. And that has shown to improve stroke recovery. Many a times, patients improve on the table itself. We have had patients who were completely weak, unable to speak. As soon as the blood flow was restored, on the table in the cath lab, patient is speaking. I remember clearly.
Procedure is done with the patient awake.
Yeah, so it depends. So if the patient is cooperative, which many might not be, so we give some mild sedation, or sometimes under general anesthesia, we might have to do the procedure. But I remember I had an 88-year-old who had come with an occlusion in the blood vessel of the brain. We did this procedure, was immediately able to talk there and there on the table. And he asked me one question: "So, will I be okay?" I said, "I will celebrate your 100th birthday together." So, it is that a strong treatment that we have now. So, and all this has to be done quite quickly. You cannot say that we will decide and then take a call what to do. It has to be done immediately to achieve the best results.
You talked about treatment. These options are for when there is a block. But
Yep.
when there is a bleed, what do you do?
So sadly, for the patient, once there is a bleed, there are not many treatment options available as to giving a drug that stops the bleeding. But as of now, for any patient with bleed, treatment is primarily to control the bleed by controlling the blood pressure. Sometimes in some patients, there are abnormal vessels that bleed. So we have to take care of those blood vessels. So that is a different surgical procedure that needs to be done in there.
Are there a lot of cases in which the stroke also leads to infections in the lungs and pneumonia? Because in that moment, sometimes people think.
Yeah, so it might not be the direct effect in the sense stroke causing pneumonia, but yes, because of stroke, what happens is that as one knows that it weakens one side of the body, similarly the muscles in the mouth also weaken down, and that is when the patient is not able to swallow anything. And if they have given many a times, what happens, we have had patients that they have been forcefully fed because they think that he's acting up, not able to swallow, and that food then goes in the lungs.
Is they're not able to swallow it
Swallow in the
correctly.
food pipe. It does not, because the food pipe and the windpipe, they are next to each other. So our system is, nature has made our system in such a way that whenever we eat something, the windpipe closes and the food goes in the food pipe. But if this is dysfunctional, so the food will go in the windpipe, and sometimes the saliva also goes in the windpipe, and sometimes patients vomit, which goes in the windpipe, and that causes pneumonia.
Well, after the treatment that you talked about, there's obviously stroke patients have now specialized rehab. Yeah. Can you tell us what happens in this rehab?
So nowadays we have good stroke rehabilitation departments, like one we have at our hospital, Hinduja, where what happens is that a patient of stroke is getting a holistic approach with a treatment with a neurophysiotherapist, there's a speech therapist, there's a psychologist, because there's a lot of patients of stroke, they develop depression also because they are quite mobile prior to this happening, and suddenly your world comes down one day. So there's a lot of patients require counseling, they require a psychology support. We have specialized equipments like a, robotic treatment options where the patients can be made to stand using robots. We also have visual games that patients can play that improves their chances of recovery by neuroplasticity. So we recommend patients to go to a specialized centers for neuro rehabilitation so that they can get a complete care, or because the first 3 months of post stroke are the most important time frame when you can get the maximum recovery, maximum chance of neuroplasticity. So that is the time when most of the hard work should go in the rehabilitation and a specialized neuro rehab center.
Are there a lot of younger people now having strokes in your experience and
Yeah,
your practice?
yeah. We are getting good number of young patients. If you look at the Indian data, close to 15 to 20% of the stroke patients are young.
And define what is young in this context.
So young, as per the consensus definition, is anybody less than 45 years. We consider them young, young stroke. So yes, the number has gone up partly because means we are seeing more patients, which initially they never bothered to seek any treatment, possibly. Plus, the risk factors have increased quite a lot in the young population. So, what I mean by risk factors is one, which are the traditional ones like hypertension, diabetes, raised cholesterol. Those are the traditional risk factors which have gone up quite a lot in the young population. Plus, other factors like substance abuse. Number two is inactivity, too much of screen time. You'll be surprised to know that a few days back, I had a young teenager coming to me with a headache. And when asked about the screen time, she was like, I use just 3 to 4 hours a day of screen, not more. I said, please check your phone.
Yeah.
And 8.5 hours was the screen time on an average. So if you see, it is 8.5 hours in 24 hours of inactivity, which is such a huge number.
So your argument is that being on the screen constantly, it's not what it does to your brain, but the fact that the rest of your body is not moving.
Exactly.
Okay.
So because we have become inactive, where we could have become those 8 hours we could have used for some physical activity. Because if you see, like so many, like in the past when we were kids, I was talking to my nephew the other day. I was like, when we were young, when we had our vacations, by 8 in the morning we were out of the
You're out of the
house.
house, yes.
We were going, shouting, come, let's play whole day. Our parents used to literally pull us, come
Yeah.
home, have food and all that.
And
But
we would be chucked out unsupervised.
exactly,
Just get out.
get
Yeah.
out.
Just get out. Yeah.
And now we literally have to push them, go play, do something. It's become like that because so much inactivity, plus that dietary pattern changes, right? When you're on 8 hours of inactivity, you don't feel like eating on time, you eat late, you hog
Don't
on to
sleep.
don't sleep on time, you hog on to snacks and all those unhealthy food, which normally you wouldn't do if you were doing more physical activity. So all these factors combined has increased good number of strokes in younger population.
But the younger people who come to you with strokes, is there a pattern here among gender, among lifestyle? Is there something that we are doing to make strokes different for younger people, or for you to witness this change?
No, so thing is, what I saw in my population, like I have good amount of young strokes. I always ask them one question, which I found uh, that almost the answer was yes. Are you hogging on to junk food? And their answer was yes.
By junk food, you mean processed food?
Processed food, a lot of cheese, butter, buttery foods, outside food they used to call for sandwiches, pizzas, hog on to all those things rather than eating home cooked
Home
food.
cooked food.
So that was one common factor in most of the young strokes which I've observed. So, uh, so, so the saturated fats they go high in number when you are hogging on to junk food. So, which is not good for the body because it increases the bad cholesterol. And once the bad cholesterol goes up, your blood vessels start damaging. And this process starts from a young age itself. And then as the amount of damage keeps on accumulating, you'll end up with a stroke one day.
So you're saying that most of the young people who come to you after having a stroke, you notice it's because they're eating out a lot.
So that is one of the things.
One of the things.
But yes,
So so if I were to rephrase it, it would be, if I want to avoid being one of those young patients in your hospital, a good way to do that would be to stop eating out so much, to be mindful of the saturated fat intake.
yes, and also please get yourself checked for the risk factors
Hmm.
because it's always in combination with some risk factor. So, like if I'm eating too much of junk food in a hypertensive patient,
Yes.
I'm at more risk.
Yes.
In a diabetic patient, I'm at more risk. So it is one of the factors that we have seen, but there are also a combination of factors. If I'm smoking quite a lot, I'm eating junk food together. That's not good combination. So similarly, it's these are always some trigger. They are all triggers. The triggers are always in combination with a major risk factor.
So we haven't noticed the fact that it's so easy right now to just order food.
Yeah.
Could that have had because it has had a lifestyle change and more people are just ordering the meals instead of having to make them from scratch? Is that what is leading to more and more people coming to hospital earlier and earlier?
Uh,
It could.
it could be. I don't know because people can order healthy salads as well.
Yes, but why would they? There's also a lot of talk about plastics.
Right.
And our exposure to microplastics and the fact that now, there are plastics in all of the containers that we use. Microwavable containers are apparently leaching microplastics into our food. There are enough articles that say it gets deposited in our brain. Is that something you agree with?
Yeah, it gets deposited everywhere in the body. So there has been good data, good science, which is now evolving with time that they have found microplastics in almost every portion of the body. So it's very difficult to quantify as to how much is that going to have an impact in the future because that only with time we are going to know. After a few years with more studies, how with those studies, how they correlate with the events that are occurring. That is when we'll know whether yes, is it true that microplastics are the cause for stroke or not. As of now, it's difficult to answer, but definitely yes, they do get deposited almost everywhere in the body.
We talked about all of the other factors that could cause a stroke.
Right.
But we didn't. I want to talk about sleep a little bit because, I mean, right now people are telling us a lot about sleep. You're able to measure sleep with your wearables. How important is sleep? Is it just 8 hours? Is it just the quantum of sleep that's important? Tell us how this affects us.
So sleep, in simple language, is body's mechanic. It is the sleep is when the body repairs itself. The blood vessels repair themselves. So in sleep, there are a few factors which are important. One is the timing of sleep, the duration of sleep, and third important is the quality of sleep. So all three parameters are very important in sleep. So timing is many a times we see people sleeping quite late. They sleep by 3 or 4 in the morning, which is not good because what happens is that in the body's physiological system, when night sets in, there is one sleeping hormone which starts secreting in the body. Plus, at the same time, there's a dip in the blood pressure also by almost 20%. So, when you're staying awake in the night, you're not allowing that dip to occur. You're keeping that blood pressure up constantly. That triggers a stroke. Other is the duration of sleep. We have so many people who say, Sir, I sleep 10 hours a day, I sleep 12 hours a day. What you're talking about sleep. But funny, Sleep has a U-shaped pattern.
Hmm.
Okay, so the less you sleep also bad, the more you sleep also bad. So somewhere around 7 to 8 hours of sleep is the most adequate duration for sleep. So that is another thing which is important in sleep. And third is the quality of sleep. Quality of sleep means that when you have slept and when you wake up, if you wake up fresh, that is a good quality of sleep. If you wake up feeling that I want to sleep some more, that is not a good quality sleep. And the most important factor in not a good quality sleep is something known as sleep apnea. That's something that people need to know, and a lot of Indians do have that. So, what in simple terms is that many times people snore quite loud, and suddenly they pause for a breath, and then again they start snoring quite loud. Those are the patients who have sleep apnea, and for a fact, sleep apnea increases the risk of stroke by almost 2.5 to 3 times, which is a correctable thing. Okay. So you would reduce your weight, you would control your diet. And there is something known as a CPAP machine. It's a device that you connect while sleeping. So that keeps the oxygenation and all well maintained. And that treatment itself provides good quality of sleep, reduces your risk of stroke. So these three factors in sleep are the most important thing.
We didn't talk about gender. Is among women and men, which group is more susceptible to having strokes?
So statistically, women are shown to have more predilection of for stroke. Now there might be certain factors like pregnancy, birth control pills, but uh, if you look more or less, women both have equal preponderance. But if per se, just if you look at pure statistics, then women have slightly higher risk for stroke.
Do women tend to ignore symptoms more?
I think our women are quite strong because, and that is why they ignore the symptoms, because for them everything is normal. I mean to say is like stress is normal for them. Taking care of the whole house is normal for them. Take going to work is normal for them. Everything is normal. Tiredness is normal.
Hmm.
Headaches are normal. Like, believe me, this is not just for the sake of telling, but believe me, I had so many patients who just refuse to accept the fact that they are tired, because for them tiredness is also normal.
Hmm.
So that is why I feel that women, yes, could be ignoring some symptoms if they come.
While I was reading up for this conversation, I came across something I thought was fascinating. The idea that the brain, when it has an attack like this and it has lost the ability to use a portion, actually compensates and figures out how to, other parts of the brain sort of take over that function.
Yes.
Is that correct? Could you
Yes.
explain that to
So
us?
that is known as neuroplasticity, which is very important part of brain recovery.
Hmm.
So I give my patients a very simple example. Supposedly you have a company of 100 people, 40 went. There's no way to recruit those 40 back because there are no new cells going to grow in the brain. Now we have to train those 60 to compensate additionally for the 40. That is as simple in one line neuroplasticity. Though it's a quite a complex phenomenon if you go
Yes.
by that, but this is a simple example. And the earlier you do with rehabilitation, the better chances of recovery. So that is something which people should know, that having a stroke is not the end of it.
Hmm.
Definitely, yes, you have suffered a disability, but you can recover also from the disability by doing rehabilitation, which definitely makes a lot of difference in the patient's life.
So basically, rehabilitation after a stroke is to teach the rest of your brain how to pick up the function that has been
Yes.
lost
Yes.
and compensate for that loss.
True.
Tell me about second strokes. Is it's normal to assume that someone who has had a stroke will have a second stroke? Is that something that can be avoided?
Yeah. So that we call that as secondary prevention.
Okay.
So controlling blood pressure, diabetes, and all that prior to having a stroke is known as primary prevention to prevent. Now we're talking about secondary prevention. So in secondary prevention, you have to make sure the risk factors, what we discussed about, are in control. You have to change quite a lot of your lifestyle if that was one of the major risk factors for your stroke. In addition to all the traditional risk factors like blood pressure, diabetes, cholesterol, make sure that you visit your doctors regularly so that all these risk factors are kept in check. So once these risk factors are in check, the risk of developing a recurrent stroke is very less, as equal to a normal population.
This is now this idea of lifestyle as medication. Basically, we change our lifestyle. One is to prevent strokes, and then even later to be able to remove these morbidities that we have. Um, for, say, an average 30-year-old who's watching this conversation, if I don't want to be your patient, what should I do right now to make sure that my brain stays healthy?
So, two things which I advocate: diet and exercise. So, in diet, what we advocate is something known as a Mediterranean diet. So, what that includes is that your food should contain, most portions of your food should contain vegetables, fruits, sprouts, whole grains, and limitations means the things that you should avoid is processed meat, red meat, that should be avoided. Your food should contain less than 7% of saturated fats. So use better fats like extra virgin olive oil, and all those are good fats which you can use. So this is something that we advocate in terms of diet. Salt should be slightly less in the diet if you're an hypertensive. So this is from the dietary aspect. From the exercise point of view, we advocate 150 minutes per week. That's it. Okay. 150 minutes per week of moderate intensity exercise. That's all you need. Even so, if you just do 30 minutes of moderate intensity exercise for 5 days a week, Saturday, Sunday, you're off. You don't need to do even on Saturday, Sunday. So, just science has shown very robust evidence that even this much of exercise per week is good enough for your body. So, you don't need to go overboard. Plus, reduce screen time, start becoming more, uh, uh, start going out, start interacting with people, because I sometimes being more on the screen, you feel you're connected, but actually you are disconnected from rest of the world. If you see, so that is something which, three things what uh, you should do to prevent a stroke.
If we notice a family member is displaying the symptoms that you're talking about, so we're able to, maybe we can suspect that this person's having a stroke. What do we do? So put them in a car and take them to the hospital, or wait for an ambulance? What do we do when we wait for an ambulance?
Thing is, ideally there is no first aid you can provide at home. Like in a cardiac patient, like people give the sorbitrate or they give aspirin at home. But in a stroke patient, we cannot do that. The reason is because sometimes it can be a bleed in the brain. And in them, if you give aspirin, which is a blood thinning, the bleed can worsen. So many a times, our public, because out of fear, they give aspirin to the patients. We have had such patients where a family member thought it is the best option before coming, let's give aspirin and then bring him to the hospital so that we save time. But actually, that's not the right way. You have to reach the hospital. Whichever is the fastest modality you can reach the hospital, please do that. Because I know sometimes bringing the patient in the car is difficult because if the patient is completely weak, they need to be lifted. So you need to definitely call an ambulance. Keep numbers of ambulance handy on the phone. That is something I recommend so that you can immediately call and arrange for one.
Also, is it important not to feed the person anything,
Yes.
not to give them water?
Yes. Don't do anything at home. Okay. Only thing what I would suggest our guest is that if the patient is diabetic, make sure you check the sugar at home. Okay. Sometimes a low sugar can mimic a stroke.
Mm.
So that is something which is important. So if the sugar is low, then that you can correct at home.
We'll correct immediately.
You can correct immediately. So in a patient of diabetes, like we had one patient while I was in Canada, Calgary, during my training. He had two episodes recurrent where he became weak suddenly, then used to recover, became weak. We were all perplexed as to what is happening, figuring out the cause. We couldn't find anything. And then suddenly one day, he didn't tell us that he had put a portable device for measuring the sugar. So he had rolled up his sleeve one day and we could see the device. We said, since when have you put this? Almost for a week prior to the symptoms started. We checked his records, the data, and he had low sugars exactly at the time of the events. So low sugar is a mimicker of stroke. So if somebody is a diabetic, known diabetic, always better to check sugars at home because that is something which you can correct at home itself.
You did talk about high blood pressure, but is there a risk from low blood pressure?
Low blood pressure causing stroke in certain patients, yes, but if somebody is having low blood pressure, you would definitely be in the ICU. But that low blood pressure will occur because of some other cause.
Yes.
It might not be because of the stroke. It might be because of some other cause, most commonly causing low blood pressure. So that is not something that we routinely encounter in a stroke patient.
Stroke patients, obviously, like you said, there is a loss, a visible loss of function, hands, legs, face. But does it also affect the other internal organs? Is that something to care about or to be careful about?
Yes. So thing is that there are always some secondary changes to any medical event occurring in the body because all these structures are some way or the other connected to each other. So always the patients with strokes can have, as we spoke about, pneumonia. They can have kidney affection. So we need to make sure that the kidneys and those things are also fine when you're monitoring the parameters. Patients with weakness, they develops joint pains, swellings. They have a lot of muscle pains also at that time. So a lot of other systems, organs also at the same time can get affected. So whenever we are taking care of the stroke patient, it is always a holistic approach where the whole body is actually being taken care of.
Yes.
And all the organs are also assessed at that time.
So I'll call out a list of things that we can do to keep our brains healthy. You can score it if you'd score it on a scale of 1 is to 10, as to, 10 being the highest, as to which is most effective. Um, Strength training exercise,
7 to 8,
organic food,
7 to 8 again.
8 hours sleep every night,
It's 10 on 10.
10 on 10. Meditation,
It's 10 on 10.
yoga,
It's 8 to 9 on 10.
Ayurvedic meditation.
I wouldn't comment on that.
Well, now that I have you here, can I also quickly ask you about migraines?
Uh, so I'm a migraine patient myself.
Really?
Yeah.
No, out of curiosity, why do some people have migraines and others don't? Do we know why?
So I think there's a strong genetic predilection to migraines. So if you see that most of the migraines run in families, like you ask any migraine patient, there'll be somebody in the family having a migraine. Like in my family, my sister has, my dad has. So we all suffer one after the other. So migraine has a good genetic predilection. So that is why you see that some of them, if two people doing the same routine, one will have a migraine, one will not have a migraine. There won't be any great change in their routines, but still.
And is it always external? Is it a response to an external stimuli? Of sometimes it smells.
Yeah, so there are certain triggers for migraine. One is lack of sleep.
Okay.
And number two is stress. Number three is heat or change in temperature. Number four is long travel. Sometimes people get triggered by long travels. Number five, strong smell. Some of them don't like strong smells. That triggers migraine. In females, migraines occur around their menses. So that is known as a menstrual migraine. And these are the most common triggers. There are certain food items also that trigger migraine in some. We don't have too much robust evidence to that, but yes, certain food items like cheese and some of them, caffeine can also trigger. In fact, caffeine we use also as a treatment for migraine. In some of them, caffeine helps in treatment of migraine, but in some of them, it also can trigger a migraine too much of caffeine consumption.
So is there no solution but to just avoid these triggers?
So yes, so solution, we have preventive therapies. So medications, what we give as a preventive therapy, they reduce the number of migraine headache days. So some of them suffer almost 10 to 15 days of migraine headaches. With medications, they come down to less than 4 headaches per month of migraine. So the quality improves quite a lot, because those 10-15 days, if they were not treated, they are almost like functioning at 50% of the capacity capability. It is very tough, because you have to work. You cannot take 15 days leave from work, but you cannot give your best also at work. So that affects the performance and everything. So we have preventive therapies that reduce the number of days of migraine headaches. So, and we have abortive therapies, that whenever a person has an acute migraine,
Yes.
so you take that medicine, your migraine gets aborted. So people with migraine definitely seek help, because just don't sit at home saying कि ये तो normal है. Many times I get patients, मेरे को headache हो रहा है but वो normal ही है. Means how can it be normal?
Yeah.
It cannot be normal. Normal means no headache. That is normal. So patients start considering headache to be normal, which I think should not be there, because you have treatment. You can offer treatment to them.
So actually, is this a really important? If you had one thing that you could tell everybody who's watching right now about not ignoring these signs that our body is telling us, or people tend to take a tablet and make the pain go away.
Yes.
As as a neurologist who's dealing with the kind of cases that come to you, what would that message be?
Message is, don't self-treat.
Mm.
That is one thing which I would always tell the patients, do not self-treat, because what happens is that when you have the habit of popping medicines when there's an headache, it actually leads to medication overuse headache. So the medications which are used to abort the headache, they themselves start causing the headaches. So because of the frequency by which you're using it. So do not self-treat. Go to a doctor, go to a neurologist. Definitely you will be started on some therapy, and that is going to help you. So that is one thing which I would advise.
In your experience, is there a particular case that you're proud of, or that comes to mind when you say, okay, that was a huge success, and that was like a marquee case for me in my career? Can you tell us a story?
So because since I'm focused too much about awareness,
Hmm.
okay, so and I would want like Indian public to also be aware of the stroke thing. I had this case in while my training in Canada, uh, where we, because the pre-EMS system is also quite strong, in because they're quite well trained for catering to stroke patients. So the patient came to us, we treated the patient, everything was fine. Then we were sitting and speaking to those guys, and they were like, a 6-year-old had dialed 911 to say, I think my grandfather is having a stroke. A 6-year-old boy, first grader, is telling 911, I think my grandfather is having a stroke, because he was alone with his grandfather that time. And that is how that grandfather was brought in, could be treated, went home walking. But that is the awareness which needs to be spread amongst the public, so that as soon as the symptom is there in front of you, rush.
Yeah.
That is something which is on terms of awareness. In terms of treatment, we have had lots of successes in terms with these medications. Like recently, just uh, 2 days back, this patient who had come from Surat, he had come specifically to get treated, was completely weak on one side. We treated him, supported him. He was quite even sad, depressed also. Family was anxious, got good rehab, everything. And 2 days back, he sends his video of him jogging. So that gives me so much of happiness, from a person who was not able to move his limb, now is able to jog. Means it gives me so much pride. He asked me one question. He told me that, sir, I feel that I don't like socializing now that much because there's still some disability with me. I said, no, you're a stroke survivor. What you have done is remarkable. So you should be proud of that. And in fact, you should go more socialize and
Tell people. Yeah.
tell people that this is the change that you can bring. So, yeah,
Dr. Doshi, thank you for the work you do.
thank you so much.
Thank you for sharing all of these stories and answering our questions.
Thank you so much, Ray.
Thank you.
Thank you.